Hi, good morning, Helen.
Hello.
How long have you been in this profession?
That's a very good question. Let me count back. I'm a clinical psychologist, and I've been, in the kind of area of mental health and research, relating to mental health for about it's over 10 years.
Okay. So as a clinical psychologist for many years, what do you think is the best way to keep a person mentally healthy?
I guess there are two parts to it. One is, looking at things from a prevention kind of perspective. So it's actually trying to prevent, problems in mental health and mental health issues. So a lot of that is about kind of maintaining a healthy kind of lifestyle in part. So we know that things, for example, like maintaining good level of physical activity, having a good amount of social support, and being connected to communities, to family members, to friends. So having a sort of supportive environment. So the relationships are actually really important as a buffer against some of the things that sometimes happen in life.
So in adverse situation of patient you've had in the last couple of years, how have you helped families cope with the circumstance of their family member?
So a lot of the time, I think one of the really important things that the government expects of us as well is being able to communicate with carers, so people, families, and people who are in the immediate kind of supportive environment of those individuals who are experiencing mental health difficulties, having good communication with them, but also recognising and respecting the person who has the mental health difficulties. Not necessarily going and telling family members everything about what's going on, but really where possible, trying at every point to work together with the person with mental health difficulties, as well as reaching out to people who are supporting that person during their mental health difficulties. So. I guess it's about making sure that communication is there, making sure that they're aware of what's happening. And in fact, actually, what we know from the evidence is that if a person who is having difficulties with mental health problems, they might get access to treatment and interventions, but they have to eventually go back into those family and community environments. So making sure that they're actually part of and have a good understanding of treatment and intervention to help support that person during their recovery period. So all of us, have a responsibility to be engaged in that. Yeah.
So do you think the government has done enough to improve the mental health institutions in this state?
In this state?
Yeah, in this state.
Look, I think, there's been massive changes over the past probably 9 to 10 years, which has really gone a long way to addressing, to improving access to mental health care. I mean, just a huge amount of funding, and there's, I don't think we have to be able to recognise the sheer kind of support that the government has provided. Listening to listening to communities, listening to health professionals like psychiatrists, like psychologists, like social workers, like OTs. So everybody in all kinds of community organisations that are actually involved in the mental health sector, they've worked really hard, I think, at listening and trying to develop ways of being able to provide sufficient services and support. I think so. That's the kind of good part. I think where it's probably still lacking is that and that's not just the government, but we need to do a much better job of integrating and services and communicating between services to make sure that the experience that a person with mental health difficulties has is one that is respectful and knowledgeable about their case as they move through the system. Because what you often have is people going from one service to another service to another service, and so I think the government needs to do a much better job at coordinating a lot of those, the way that services are delivered, or at least facilitating and helping community organisations and health, the health sector generally, in terms of coordinating and to provide the appropriate kind of care that's needed for those people.
My last question is, do you think the Mental Health Week is a great help?
Yeah, I think a lot of organisations like Beyond Blue, for me as a clinical psychologist, the Australian Psychological Society has also been really important. So they've done a huge amount of work in terms of public campaigns to try and improve mental health awareness and reduce the stigma that's associated with. So, campaigns like Are You OK Day, the Act, Belong, Commit program, a lot of those are fantastic kinds of campaigns, and it really focuses the attention on mental health during Mental Health Week to really get the message out there that I think we have. It's a community responsibility to support the mental health of all of the members of our community. So,
Okay, that's it. Thank you for your time.
Thank you.